Hello, my name is Anne Holliday.
And my name is Terry Shanks.
And we are nurse aid instructors at Warren Memorial Hospital in Front Royal for Valley Health.
We are going to demonstrate today 22 skills that nurse aides have to perform for their state certification test.
Right.
And I'm wetting my hands.
Now she's going to put soap on her hands, lather all surfaces of the fingers and hands, including the wrists, producing friction for at least 10 seconds. Now she's going to rinse so that she doesn't rinse the dirty soap over the freshly washed tips of her fingers. Using a dry, clean paper towel now, she's going to dry all surfaces of the hands, wrists, and fingers without contaminating her hands. And this is important to dry from the fingertips up. Remember, always go from clean to dirty. When she gets to the dirty section, the part that she hasn't washed, she will discard the towel. Fingertips up. And then she will take a dry, clean paper towel, switch off the faucet, and toss the paper towel away immediately, avoiding the temptation to clean up the sink.
Now we are going to show you how to measure and record a ambulatory patient's weight. Good morning, Mrs. Holliday. My name is Terry and I'm your nurse aide for today. How are you?
I'm fine, thank you.
We need to walk you to the scales and weigh you for the nurse. So I'm going to have you sit up, get your balance, put your shoes on here. Do you need me to tie?
No, I can tie them just fine. Thank
This is a very independent patient. Who's a little unsteady. I'm going to walk you to the scales. The scales are already zeroed out. You need to make sure you zero your scales out. Have the patient step on them. Kind of look at what you think she would weigh. Have her step off, take you back to bed, take your shoes off for me, hold the number in your head so you can record it, and get comfortable, Mrs. Holliday.
you.
Make sure the bed and your controls are usually on your bed unless you have the old crank beds, which the controls are at the foot. This raises and lowers, and then inside head and feet. So we want to leave the bed in the lowest position. We need to provide Mrs. Holliday with her call bell. Mrs. Holliday, if you need anything, there's your call bell.
Thank you.
You have a good day. I'm going to put my name on the measure and record sheet, Terry Shanks, and under weight, I have recorded her weight in pounds. Then I would hand that in. Oh, and last but not least, after every skill, you need to say that you'd wash your hands. So I need to wash my hands because of infection control, but I would not walk over to the sink and use water. You will only use water one time.
The next skill I'm going to demonstrate is mouth care. And for mouth care, I need an emesis basin, toothpaste, a toothbrush, a towel, and some cold water. Because I'm dealing with body fluids, I need to take gloves with me. I have washed my hand, gathered my equipment, and now I'm going to greet my patient. Good morning, Mrs. Shanks. I'm coming to help freshen up your mouth. Now I'm going to put your bed up a little bit so that, here we go. Okay, now I'm going to raise your head. Feel yourself going up. Protect the clothing with a towel. Can you open your mouth for me? Put your teeth together like this, that's right. Teeth together, that's right. Now open your mouth for me. Now can you put your tongue out for me? Swish, spit. One more. Yes, thank you. Now, would you like to sit for a while, or would you like me to put the bed down again for you?
I think I'll sit for a while. This feels good.
All right.
A nice clean bed.
Taking the equipment and cleaning things up. Taking my gloves off so that I do not contaminate myself. And I'm now going to give Mrs. Shanks a call bell. That's right. Now I would wash my hands. Now I'm going to perform skill number 4 in the purple handbook, which is dressing an affected right side. I have washed my hands and I am going in to greet my patient. Knock, knock. Good morning, Mrs. Shanks. I'm coming in to change your gown. What would you like to wear? Would you like a top or some pants or pants? Okay, I will go there. Let me come around to this side of the bed. This on. I would provide for privacy. If she's in a private room, I would just close the door. Let me take this. Can you sit forward for me? Take this one. Okay, take this left arm out for me.
have your hand. And can you put your arm through for me? Thank you. Just lean back. These snaps are tough sometimes. I'm coming this side. At least I got it. All right. Put your foot through your head for me. Yep. Let me help you pull these up. That's a good idea. Have you put your shoes on before you stand up so that you don't slip? Laying in this bed, I'm gaining a little, so I need to exercise. Okay. Good boy. All right, can we take a step over to the chair? They're crooked. Just feel this is crooked. I don't care. Just feel the chair and sit down. Okay. Here's your bell, Mrs. Shanks. And call me if you need anything. And I would take the dirty gown and place it in, oh my goodness, soiled laundry. This skill is transferring a client from bed to wheelchair, and we recommend you using a gait belt, also known as a walking belt. Equipment that we will need: gait belt, wheelchair, and we're also going to use non-skid footwear, grippy socks. First of all, I would wash my hands, gather my equipment. Good morning, Mrs. Holliday. We are going to get you up out of the bed. So we're going to transfer Mrs. Holliday to the wheelchair. We would provide for privacy, but for the inability to see, we're going to leave the curtain open so you can see what I'm doing. You want to put your wheelchair as close as you can to the bed. Make sure footrests are out of the way. We can move those out of the way. Make sure that you lock, which the red tape here shows where the brakes are on the wheelchair. You want to make sure that you lock the brakes on the wheelchair. I'm going to put the head of the bed in an upright position. We're also going to make sure that we put the bed down at a good height for Mrs. Holliday. This is allowing the bed to assist you with transferring. Good. That's fine. First of all, I'm going to assist Mrs. Holliday. If you'd scoot to the edge for me, please. It's easier to actually put the non-skid footwear on while the patient is in the bed, but we'll just apply it as she's sitting up. Make sure this is snug. You go through the teeth and then through the gums. Thank you. Okay, let's scoot to the edge let you get your balance. I'm going to pivot you around. Feel for the chair. I'm going to sit you down in the chair, Jack. Make sure her hips is up against the back of the chair. Put feet on footrest. Leave her set in her room. Sitting in her room, and make sure she has her call bell. Thank you. We will remove the gate belt. And depending upon the amount of time that the patient actually is sitting up, you can leave the gate belt on them. Are you comfortable?
Thank you.
Have a good day.
Thank you.
I'm going to put my equipment away. And last but not least, wash my hands. This needs to be part of a CNA's uniform when you work in healthcare is your gate belt. It does give you the option to ambulate without a gate belt, but we choose not to use them. First of all, I'd wash my hands, gather my equipment, which I have my gate belt and my grippy socks. Good morning, Mrs. Holiday.
Good morning.
How are you?
I'm fine, thank you.
We are actually going to get you up and take you for a walk this morning.
Oh.
First of all, I need to put your grippy socks on. And you can also use their shoes if they have appropriate footwear. I'm going to show you another way that we can get Mrs. Holiday up. If the first transferring skill, we set the bed up in an upright position. This time we're going to scoop Mrs. Holiday to the edge of the bed. You can scoop for me. Now I want you to roll over. You're going to roll toward me this way. Roll over on the side. Okay. Now, I want you to push up to the bed with your height so your feet. I want you to push up and we're going to set you up. 1, 2, 3. There we go. We're going to bridge the knees. Set you back a little bit. Escape belt on you. Snug.
It's fine.
You ready? I'm going to stand up on a count of 3. 1, 2, 3. Turn around. I'm going to take you to this cabinet and back. You want to walk behind your patient and to the side of your patient. You're going to turn around. So that way, if Mrs. Holiday goes to fall backwards, I have her here. She can sit down on my knee, and you would ease her to the floor. It's good to be up walking.
Yes.
And take your gate belt off. Put your back to bed here. Spin you around. Remove the grippy socks. Make sure Mrs. Holiday is comfortable. Here's your call bell if you need me. Thank you. Put the bed in the lowest. You're welcome. Put the bed in the lowest position. And you have a good nap. And I wash my hands.
I'm going to clean dentures. And to clean dentures, the dentures are already here. I don't have any patient interaction. I need a brush and toothpaste and a pair of gloves. I'm going to line the sink with a couple of paper towels, being careful not to cover the drain. just in case I should drop the dentures. Always place the lid upside down, and I'm going to drain the water from the dentures and put the dentures on the paper towel and rinse out the cup so that I have a place to put the dentures when I'm finished. Cold water. I'm going to put toothpaste on both parts of the denture brush. Rinse the dentures under cold water and brush every surface. Rinse. Put in a clean cup. Return these to the storage place. The next skill number 8, range of motion, which is exercise to a patient's limb. The exercise that we are going to perform this morning is range of motion to a shoulder. Abduction, adduction, flexion, extension, internal and external rotation. First of all, I would wash my hands. The only equipment that I will need is my patient lying in the bed. Good morning, Mrs. Holliday.
Good morning.
I have come to do some exercises with you on a shoulder. You just let me know when it hurts. We would provide for privacy. I've explained the procedure, now I'm going to perform the procedure. Make sure that you put the bed in a good working height. You want to support the limb with the wrist and the elbow. Flex, extend, flex, extend, flex, extend. Move slowly, gently, also watch your patient's face. Now we're going to do abduction and adduction. Add, ab, add, ab, add, ab. You okay? Yes, thank you. External and internal rotation. External and internal rotation. External and internal rotation. We're all finished. Make sure that you leave Mrs. Holliday the call bell. Here's your call bell, Mrs. Holliday.
Thank you.
Are you comfortable?
Thank you.
Put the bed in the lowest position for safety. And I would wash my hands. The next skill is skill number 9, range of motion of a knee and ankle. Good morning, Mrs. Holliday. My name is Terry and I'm here to exercise your knee and ankle. First of all, I would wash my hands, gather my equipment. My only equipment is my patient in the bed, provide for privacy, and explain the procedure, which I've already done. We will put the bed at a good working height. Only expose what you need, and we will expose the knee and ankle. And I'm going to work on her left knee and ankle, the one closest to me. We're going to flex and extend. So flex, extend, flex, extend, flex, extend. For the ankle, dorsiflexion, plantar flexion, dorsiflexion, plantar flexion, dorsiflexion, plantar flexion. Move slowly, gently, smoothly. If we meet resistance or she's in pain,
you would stop. Look at your patient's face. Make her comfortable. Miss Holiday, you have a good morning. Is there anything you need? Put the bed in the lowest position. Give the call bell. And wash my hands. You have a good day. Now we are going to show you how to measure and record urinary output, skill number 10 in your purple candidate handbook. The equipment that we will need, gloves, but first of all I would wash my hands, gather my equipment, which is a graduate or measuring cup. On one side is ounces, on one side is cc's. We would encourage you to focus on the cc's. We know that 1 ounce equals 30 cc's. And when you are finished this skill, you will measure and record on a measurement sheet, because this is information that you would need to supply to your nurse. There are 2 types of bedpans. This is a fracture pan as well as a regular bedpan. So after I measure and record, I'll just show you the other bedpan. You're going to pour without spilling. And you're going to measure at eye level. I'm just going to set this down here. And this is in increments of 25. So 500, 525, 550, 575, 600, etc. So looking at this at eye level, this is 575 cc's. I'm going to go ahead and rinse the bedpan. I'm going to dry that out. I'm going to pour. This bedside commode is to simulate our commode bathroom. Pour the rinse water. I would dry everything off. Dry this out. And hold that number in your head, 575, because you need to dry everything and then we're going to put everything away. You want to dry it well so you're not putting it back away. And then you will remove your gloves. So we'll put everything away. Before I remove my gloves, I want to just show you the other bedpan. This is the regular bedpan, and when you pour the urine from this bedpan, you would have to pour from this end instead of the larger end. And I always tell my students, the funny is, no pee on the pen. No pee-pee. Urine on the pen. So you would need to remove your gloves without contaminating. Wash your hands and then record. You want to record in cc's under output, and it was 575 cc's.
This is skill number 11. I'm going to assist a client with a bedpan. And for this skill, I am going to wash my hands and gather my equipment. I'm going to get a bedpan, some toilet tissue, and some hand wipes. And knock knock. Good morning, Mrs. Shanks. You rang for a bedpan?
Please, I have to go.
Okay. I am going to put your bed down. Put your head down so that I can sit you on the bedpan. You okay?
Yes, and I can raise my hands.
Oh. Bend your knees, dig your heels in, and raise up for me. All right, down. Okay. Now I'm going to sit you up again so that it'll be a little easier for you to go. There you go, you're all the way there.
We just showed them how
Is that comfortable?
yes, how the bed head is placed underneath of us, underneath the beat, so that they can see.
I'll tell them when I do the fracture. You okay? Now, here's some toilet tissue for you. And here's the bell. And you ring for me when you've finished. You have to say ring, ring.
Ding, 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 ding.
Now, I need a pair of gloves to take the bedpan away. I'm going to let your head down again. All right?
Yes.
Now, can you bend your knees and lift up for me? Thank you. Thank you. Thank you. Now I'm going to take this and empty it to the toilet, rinse, empty. And return to the storage. Now I'm going to take off my gloves and wash my hands. And now I am going to give the patient a handy wipe so that she can wipe her hands. Please wipe her hands. Thank you. Now here's your bell. Would you like to sit up or are you comfortable?
I'm comfortable.
Call me when you need me. Thank you. There is an opportunity to use two different kinds of pans. This is a fracture pan and it would go in this way. The other pan went in, of course, with the broad side to the back. And this is Pericare. And I've washed my hands and now I'm going to gather my equipment. For this skill, I need a basin, soap, a washcloth, a towel. I need a clean pad and I need a bath blanket. And I also need a pair of gloves. I am going to go and get water from the sink. And I'm testing the temperature of the water. And that's a good temperature. Good morning. Good morning, Mrs. McGuire. I'm coming to freshen you up a little bit. And I'm going to provide for privacy. I'm going to put this blanket over you so that you don't get chilly while I clean up your little part here. I'm going to raise your bed for you. Now, I'm going to put on gloves. And Mrs. McGuire, I would like you to turn onto your side and hang on to the bed rail so that I can just fold over this wet pad here. Letting you come back. That's good. Now I'm going to wash the perineal area. Do not put soap into the wash basin. Rinse out the cloth and put a little soap on the cloth. Wipe down the outer labia, turn the cloth. The outer labia, turn the cloth. Separate the labia, the inner labia, turn the cloth, inner labia, turn the cloth, and then straight down the center. Rinse the cloth and repeat that procedure. Bundling the cloth so that it doesn't flap around. Outer labia, turn, outer labia, turn, separate the labia, the inner, and straight down the center, and pat dry. Now, Mrs. McGuire, I would like you to roll over onto your side for me. Hold on to the bed rail. I'm going to put the towel down and complete the perineal wash. A little soap. The upper buttock, change the cloth. The lower buttock, change the cloth, and straight down the center. Rinse. Rinse the upper buttock, change the cloth, the lower buttock, change the cloth straight down the center, and pat dry. And take a clean pad, roll the dirty one now completely through. Mrs. McGuire, come onto your back for me. And come over towards me a little bit. It's getting uncovered here. Alright. Take the dirty pad out. Pull the clean one through. And let's put your sheet back up. All of these linens go into the laundry, and clean up. return to storage. I take off my gloves and wash my hands. And Mrs. McGuire, here is your signal bell, and I'm going to let your bed down now. You ready? And leave the bed in the lowest position. And close it.
We are now going to demonstrate calf care, skill number 13 in the candidate handbook. First, I would wash my hands, gather my equipment. I'm going to have an overbed table to put my equipment on. That blanket, towel, washcloth, basin, soap, gloves, and water. And as you're gathering the water, you need to make sure you test the water temperature. Mrs. McGuire, my name is Terry, and we are going to clean your catheter today. You want to make sure you provide for privacy. Bed of a good working height. We are only going to expose the area that we're working on, which is the catheter. Put a towel down so that you won't get your pad soaked, because this is a skill that you do not need to change your bed. And as you can see, the catheter is an indwelling catheter, and you need to wash your, we will need to clean the tube 4 inches. When you apply your soap, soap on the cloth, not in the water. A little dab will do you. You're going to hold it, point of insertion, and you're going to swipe down 4 inches. Change your cloth, hold it, point of insertion, swipe down, change your cloth, hold it, point of insertion, swipe down. Now we are going to rinse. Well, make sure you hold your cloth so it's not flopping around. Hold it, point of insertion, swipe down, change your cloth. Hold it, point of insertion, swipe down. Hold it, point of insertion, swipe down. You may pat dry, but your candidate handbook does not mention that, so it could just air dry. Now we are ready to clean up. Mrs. McGuire, we are all finished, so we're going to clean you up now. Also, you do not want to expose the patient. So I'm removing this without exposure. putting everything in the dirty hamper. Put things away as you go. Rinse and dry. Remove my gloves without contaminating. Miss McGuire, we're all finished, so I'm going to put your bed down in a low position. Are you comfortable? Make sure Mrs. McGuire has her call bell. The whole bed goes down in the lowest position. Last but not least, after everything's done, wash your hands. The next skill is skill number 15, measuring and recording a pulse and respirations of a patient. I would wash my hands, gather my equipment, which is pen or pencil, and a record sheet. If you have trouble finding it, trace down the thumb to find this is the radial pulse that I'm taking, and you would count with a watch with a second hand 1 minute. And your pulse is 60, so I'm going to record 60. Now, for respirations, you're going to pretend that you're taking a pulse so that Mrs. Holliday doesn't increase or decrease her respiratory rate. And again, you would take respirations, which is an inhale-exhale for 1 minute. Before leaving Mrs. Holliday, make sure that I've given her the call bell and the bed is in the lowest position. And last but not least, wash hands. The next skill is skill number 16, measure and record blood pressure. I would wash my hands, gather my equipment, which is a blood pressure cuff, also known as a sphygmomanometer. We have pediatric, we have large, but for Mrs. Holliday, we will use a regular cuff, alcohol wipes, and for testing purposes of the state, we will use a dual earpiece stethoscope. Two of these together. And this is so the rater as well as the student can listen together. And again, you do not need to provide privacy for this one. Good morning. Hi, Mrs. Holliday. I'm here to take your blood pressure.
Thank you.
And raise your bed a little bit. Put your head on this hand. Do you have a blood pressure taken in this arm?
Yes.
Your blood pressure cuff, which I'm going to apply, has an inflator and deflator, as well as your gauge, which is in increments of 10 and then 2. And I'm just going to show you here, for example, between 60 to 80. The next bold line would be 70. In between that, it's 2, 4, 6, 8, 72, 4, 6, 8, etc. Palm up. Thank you. Make sure you have a pulse, which is the brachial pulse is which I'm going to use. Plus, make sure you clean your diaphragm, bell, and earpieces before taking. When you place your earpieces into Your ears, make sure they're facing toward the nose. Test it. You'll feel a little squeeze. And I pump it to about 160 unless I know their baseline. Good blood pressure, Mrs. Holiday. 130/70.
Thank you.
Now we will feel that. You'll record under blood pressure. Make sure that the bed is, your paw bell is with you. Put it in nice position. I'm going to put your equipment away. And two things before you leave. You want to make sure that you hand this in or turn this in, and also I would wash my hands. Okay? Now we are going to perform skill number 18, applying elastic stockings, also called Ted hose. First of all, I would wash my hands, gather my equipment, the Ted hose. Good morning.
Good morning.
Privacy. The doctor has ordered some elastic stockings, some Ted hose for circulation, and I need to put it on for you.
Thank you. Thank you.
Bed at a good working height. I'm only going to expose her foot, that I will apply the Ted hose. Make sure you take the sock off. Do not apply it over the sock. Look at where the heel is. Turn it inside out. Make sure that you apply it smoothly, gently. Up the leg. Thank you. The heel needs to be on the heel. Still have some wrinkles. I'll bring you back up. Make sure that the bed is in a low position. Call bell.
Thank you.
Make sure that you do not drop any linen on the floor. I'm going to leave this in this chair, Miss Holiday, if you need it, your sock.
Thank you.
And I would wash my hands.
I'm going to perform skill 19, which is changing an occupied bed. I've washed my hands. I'm going to gather my linen. A top sheet, a bottom sheet, and a clean pillow slip. Good morning, Mrs. Shanks. My name is Anne Holliday, and I'm going to come and give you some clean linen. I'm going to provide for privacy, and I'm going to put your bed up for you then for a while. I have the bed at a good working height. And I'm going to put your head down a little bit. Alright? And I'm going to start, since that bed rail is up already, I'm going to start. I want you to turn over onto your side and hold on to that bed rail for me. Thank you. I'm going to loosen the sheets. Open the bottom sheet without flapping it. Pushing the bottom sheet at least to the center or beyond the center of the bed. Now, Mrs. Shanks, can you just come over onto your back for me? Make sure she doesn't roll herself into the sheet. Bring her pillows so she doesn't roll her head off. And bend your knee and turn over towards me and hang on to this rail now. Thank you. This sheet will go in the dirty laundry. All right, Mrs. Shanks, come back onto your back. Thank you. Now, change the top sheet. Now, can you hold on to this sheet for me while I pull the bottom one off?
Yes.
And into the dirty laundry. Have enough room for your toes? Good, dear. This is comfortable. Now I'm going to take a pillow from you. Alright, just lean back. Put the pillowcase on the slip so that it doesn't touch your body or your uniform. And drink it for me. There's your call bell. And I'm going to put your bed down.
the whole bed.
Would you like your head up a little bit? Look at this.
I'll take my nap now. Thank you.
All right. The curtains. Now I would wash my hands. Now I'm going to do skill 20, and this is foot care. And for foot care, I've washed my hands, and for foot care I'm going to gather my equipment. A bowl, soap, lotion, and a towel, and a washcloth. And good morning, Mrs. Shanks. My name is Anne, and I'm coming to wash your foot for you. Joy. I'm going to put the whole bed up so that it is at a good working order. A good working place. Are you comfortable?
Yes.
Just going to expose one foot. I'll put the sock right there. And I'll just warn you, I have a ticklish foot. It's all right. I'll be very careful. And now, Mrs. Shanks, can you bend your knee for me? Bend your knee. Right, I'm going to bring the bowl up here so that when you put it into the, put your foot into the bowl, it won't. We must have not paid the hot water bill. Soap, and lift your foot out for me, and make sure that you wash between the toes, and put it back in and just rinse it off. Put your foot down. Can you stretch your leg out for me? That's right. Good. Was good. I know. It's one of those tricky things. I'm going to put a little lotion on your foot. Now I'm going to let the bed down for you. It's right here. Have your cold now, right? Yes. Thank you. this will go into the laundry. And I will clean up. And put away the equipment. Now I would wash my hands. Now I'm going to perform skill 21, providing fingernail care. I will wash my hands, gather my equipment, a towel, Ennis's basin, orange stick, nail stick, and fingernail file. You can use an Ennis's basin or a bath basin. We use a bath basin. Good morning, Mrs. Holliday. My name is Terry. I'm your nurse aide, and I need to clean your fingernails. Provide for privacy. Gather some water. Test your water temperature. Inner aspect of the forearm. It's warm this time. I'm gonna watch Miss Hollanday's needs. Holiday, I'd like you to put your hand up to this basin for me. Give me a second minute. At your knees. No, it's fine. You would just put your hand flat. Loosen the dirt. Now, I'm going to tap that dry. Get your band-aid on there. Now, you only need to do a couple fingernails. You're going to use the dull edge. You're going to swipe and wipe. Swipe and wipe. Swipe and wipe. Now we need to file. Kind of a rounded. Make sure they're smooth. Okay, Mrs. Holliday, I'll clean this up. Would you like your nail stick or orange stick? No, your board. This will go in the left handle. I'll be back to make you comfortable. Throw this away. I'm going to dry everything out after rinsing and washing everything. That away too. Would you like to sit up or lie down? Lie down. Put this together, the head and the bed. That's good. Make sure we have a barbell. There. Now I would wash my hands. Now I'm going to perform skill number 22, feeding a client or patient. First of all, I wash my hands, gather my equipment, clothing protector, not a bib,
the tray with the diet card. And before I get to Mrs. Jones, I'm just going to verify her diet here. She's room 101B, regular diet, no known allergies. Good morning, Mrs. Jones.
Good morning.
How are you? It's breakfast time.
I'm hungry.
Now your coffee's a little warm, so be careful. I need to set your head up. Put the bed up at a good working height. I'm going to sit you all the way up.
Thank you.
90 degrees. Tell me if that hurts your back.
No, it's comfortable.
Okay. Need to put this body protector over there. I can put the rail down because I would like to sit beside you while I'm feeding you. And we have some cereal and we have some pudding and some coffee. Let's start with the
Pudding, please.
Is it good? Would you like another bite or something?
Yes, please.
The coffee is warm, the way you like it. And your diet card says that you do not care for sweets, so you don't want the corn pops. Would you like any more pudding?
No, thank you.
Let's wipe your mouth. If you need to wipe your hands on the clothing protector, you may do so. We'll remove this. Would you like to keep your coffee?
No, thank you.
I'll be right back. I'm just going to put this away. Allow our patient to sit up at least 20 to 30 minutes after a meal. This holiday, it's time to put you back down and make you comfortable. You have your umbrella. We'll also put your bed in a low position. Are you comfortable? You do not need to provide privacy for feeding. And after everything is cleaned up and the patient's comfortable and safe, I would wash my hands. Now we are on skill 23, positioning a client on her side. And I'm going to position Mrs. Holliday on her right side. I would wash my hands, gather my equipment, close. Good morning.
Good morning.
Hi, my name is Terry, and I'm your nurse aide. I'm here to turn you on the right side
Thank you.
and make you comfortable. To provide privacy this rail up. Then I'm going to good work in her. You are crooked, so I'm going to come over to this side. You're not straight. You're going to just lift this from the head. I'd like you to scoot over first. Lift way over. If you would, turn on the right side for me. We want to make sure that she has pillows under her head. What you do, are you comfortable? I'm going to shift some weight off your shoulder here. You put a pillow under your arm. Put a pillow behind your back. I'm trying to prevent from exposing her. I'm going to put a pillow just so you can see the pillow between her knees. Right here to make her comfortable. I'll move you back up. Right in lowest position. Are you comfortable, Mrs. Holiday? Yes. Make sure you have your ball bell. I'm going to tuck your sheets in here for you real quick. Make sure that's not too tight. Okay, I'm going to leave you now. Ring if you need me, and I will wash my hands.
Now I'm going to do skill number 24, which is a modified bed bath. I've washed my hands. I am going to gather my equipment. I will need a clean gown, a washcloth, a towel, a bowl, and some water, and a bath blanket. Good morning. My name is Anne. I'm your nurse aide, and I'm coming to freshen you up a little bit. I am going to apply for privacy. Let's get some nice hot water. I'm going to put the bed up so you can feel yourself rising here. Hopefully it will wake me up. I'm ready to get up. Put this down. Now I need to take your gown off. Can I help you? Ooh, it's cold. There we go. Could you lift up for me? Thank you. up in a moment. Okay, I am not going to use soap on Mrs. Shanks's face. Close your eye for me. Change the washcloth and do the other eye from the inside out. Change the washcloth and do the rest of the face. And pat dry. Now, can you put your arm out for me? And I'm going to put the towel underneath the arm. And for this one, I'm going to use a little soap. My skin's dry, I'm sorry. Rinse the cloth. Does that feel dry? Yes. Sure. I think I put it clean there. You put your arm through for me? Thank you. And the other one. Thank you. Just lean back for me. I'm going to put your bed down for you. Give you the call bell. Where's the call bell? Give me a call. Healthy? Now I would wash my hands. Put my laundry away first. And now I would wash my hands. This concludes our skills videotape. We hope that you will find this useful. Remember that practice makes perfect, and we wish you great success in passing your certification test. We certainly do. And thanks, enormous thanks, an incredible debt of gratitude goes to Sandra Flynn, who filmed this for us. Sandy was a former student in the nursing assistant class, and she has filmed all these skills for us, and we thank her very, very much. Thank you, Sandy.
Thank you, Sandy. Remember that you have 25 minutes to successfully complete 5 skills. So good luck, stay calm, and practice.